to talk about the color to the wrap-up section of the series on art therapy. First of all, I will divide it into two parts, a summary of the key points and a call of the action. Let's talk about the summary first. As a non-verbal tool of expression, color shows great potential and flexibility in art therapy. Different colors can convey a wealth of emotions. For example, red may represent passion or anger, but blue may convey calm or sadness. Through color, patients can overcome the limitation of speech and visually display emotional states and even subconscious emotions. This function of colors makes it an indispensable resource in psychotherapy, able to play a key role in elevating emotional distress, promoting emotional release, and enhancing mental health. A better understanding of the psychological effects of color not only helps therapists to interpret patients' psychological states more accurately, but also helps to develop more personalized and precise interventions. For example, changes in color choices can reflect psychological shifts in the patient's treatment process, providing therapists with tools for dynamic monitoring. In addition, the influence of cultural context on the meaning of color is particularly important, and therapists need to adjust for color preference and taboos in different cultures to ensure the effectiveness of therapy. Let's talk about the call for action. Therapists are encouraged to apply color therapy more widely in a variety of psychotherapy scenarios, incorporating color elements into paintings, settings, and even aspects of the patient's daily life. For example, during treatment, patients may be guided to express their inner world through the choice and use of color, while observing how color changes reflects their emotions shifts. In addition to this, therapists can also use color to adjust the atmosphere of the work environment, thus creating a more comfortable and healing space. Promote interdisciplinary collaboration in psychology, art, and cultural studies to uncover the deep connections between color and human psychology and emotion. Studies may include color symbolism in different cultural contexts, the effect of color on different psychological disorders, and the elevation of the long-term efficacy of color therapy. Through these studies, it is possible to provide more solid theoretical support for art therapy and guide practitioners to use color tools more scientifically. Use technology to develop new color therapy tools such as visual reality color experience, which means the VR, color mood assessment software, or AI-based color suggestion system. Not only do these technologies help patients explore their emotional world more holistically, but they also enable therapists to design personalized therapies more efficiently. The content of color psychology is added to the training of psychotherapists to help practitioners better grasp the theories and skills of color therapy. In addition, through the holding of seminars and public lectures related to color therapy, the knowledge of color psychology is disseminated to the wider public, and the awareness of the field of mental health is enhanced. Promotes the use of color therapy in communities and public space to improve overall mental health. For example, in places such as hospitals, schools, and nursing homes, a cozy, warm, or motivating environment can be created through the scientific selection of color combinations. This not only contributes to the improvement of individual mood, but also improves the psychological well-being of the group. Through the intuitive and powerful tool of color, we can not only help patients find inner balance and harmony, but also see the development of psychotherapy in a new light. The in-depth application and research of color therapy will surely bring a broader future to the cause of mental health. Thank you for watching, and I will bring more about art therapy in the next chapter.